You wake up at 6 a.m. feeling fine. You shuffle to the bathroom, wash your face, head to the kitchen for coffee. Normal morning routine, nothing unusual. But inside your body, something dangerous just happened. Your blood pressure spiked by 40, sometimes 50 points in the span of 30 minutes. Your heart is working harder right now than it will at any other point today. And this is the exact window when most heart attacks and strokes occur in people over 65. I'm Dr. Arya, and I've spent 25 years in geriatric medicine. And what I'm about to tell you could explain why your mother had her stroke at 7 a.m., why your neighbor collapsed in his kitchen making breakfast, why the statistics show that cardiovascular events cluster dramatically in the early morning hours. There's a hidden blood pressure surge that happens every single morning. It's called the morning blood pressure spike. Most people have never heard of it. Most people have no idea it's happening inside their body right now. And for seniors, it's one of the most dangerous things your cardiovascular system does every single day. Let me tell you about Robert. He was 71 when I first met him. He came to me frustrated because his blood pressure readings made no sense to him. At his doctor's office in the afternoon, 135/82. Perfect for his age. At home before dinner, 140/85. Fine. But he'd started checking it in the morning right after he woke up, and he was seeing numbers like 172/96. He thought his monitor was broken. He bought a new one. Same readings. He was terrified. Was he having some kind of crisis every morning? Was he about to have a stroke? I explained what was actually happening. His body was doing exactly what every human body does. But at his age, with his arterial stiffness, the normal morning surge was becoming exaggerated, dangerous even. We made some specific interventions which I'm going to share with you today, and within 3 weeks his morning readings dropped to 145/88. Still a surge, but manageable. Safe. Robert is still coming to see me 4 years later, and he hasn't had a single cardiovascular event. Because we caught this. Because we addressed it. Because he knew to look for it. Here's what you need to understand about how your body regulates blood pressure over a 24-hour cycle. Your blood pressure is not static. It doesn't just sit at one number all day and night. It follows a predictable pattern, a circadian rhythm, controlled by hormones and your nervous system. At night, when you're sleeping, your blood pressure naturally drops. This is called nocturnal dipping, and it's healthy. It's your body's rest mode. Your heart rate slows, your blood vessels relax. Pressure drops by 10 to 20% compared to daytime levels. This is restorative. It gives your cardiovascular system a break. But then, somewhere between 4 and 6 a.m., things change. Your body starts preparing to wake up. It doesn't wait for your alarm. It starts hours before you open your eyes. Your brain begins releasing cortisol, your stress hormone. Cortisol raises blood sugar, increases alertness, and it constricts blood vessels. At the same time, your sympathetic nervous system, the part responsible for fight or flight, starts ramping up. It releases adrenaline and noradrenaline. Your heart rate increases. Your blood vessels tighten. Blood pressure starts climbing. Then you actually wake up. You sit up. You stand up. Gravity pulls blood toward your legs. Your body compensates by constricting vessels even more and pumping harder. Within the first hour of waking, your blood pressure can rise 20, 30, even 40 points from its nighttime low. This happens to everyone. Young people, old people, healthy people, sick people, it's universal human physiology. But here's the critical difference. In a young person with flexible arteries, this surge is absorbed. The vessels expand to accommodate the increased pressure. The system flexes. No damage occurs. But in someone over 65, particularly someone with any degree of arterial stiffness, those vessels can't absorb the surge the same way. The pressure rises, and it has nowhere to go. It slams against stiff arterial walls. And that's when plaques rupture. That's when clots form. That's when strokes happen. Let me give you a statistic that should be talked about far more than it is. Approximately 40% of all heart attacks occur between 6 a.m. and noon. That's not random. That's not coincidence. That's the morning blood pressure surge doing damage in vulnerable people. Strokes follow the same pattern. The highest incidence is in the early morning hours, right when that surge is peaking. Sudden cardiac death, same pattern, early morning. We've known this for decades. We have the data. But very few doctors talk to their patients about it. Very few seniors know to monitor for it. And that's a massive gap in preventive care because this is measurable, it's manageable. And it's a warning sign you can catch before something catastrophic happens. So what makes the morning surge worse in older adults? Let's break down the specific factors. First, arterial stiffness. I've talked about this before, but it's worth repeating because it's foundational. After decades of use, your arteries lose elasticity. They become rigid. When pressure rises, they can't expand to accommodate it. The surge becomes sharper, more extreme. Second, your baroreceptors, those pressure sensors in your blood vessels, become less sensitive with age. In a young person, when pressure starts to rise, baroreceptors detect it immediately and signal the body to compensate, to ease off the gas pedal. In an older adult, that feedback loop is delayed. The pressure rises higher before the body recognizes it and responds. By the time compensation kicks in, you've already experienced a dangerous spike. Third, many older adults have what's called non-dipping blood pressure at night. Remember, your pressure is supposed to drop 10 to 20% while you sleep, but in some people, particularly those with diabetes, kidney disease, or sleep apnea, that dip doesn't happen. Pressure stays elevated all night. Then the morning surge adds on top of an already high baseline. You're not going from 110 to 140, you're going from 145 to 185. That's stroke territory. Fourth, and this is something most people don't know, dehydration overnight makes the surge worse. You don't drink water while you're asleep for 7 or 8 hours. Your blood volume decreases slightly. Your blood becomes more concentrated. When your body triggers that morning surge, it's working with thicker blood and slightly less fluid volume. That combination increases resistance and drives pressure higher. Fifth, morning cortisol. Everyone gets a cortisol spike in the early morning, it's normal. But in people under chronic stress, people with anxiety, people who sleep poorly, that cortisol surge is exaggerated. More cortisol means more vessel constriction, which means higher pressure. And finally, the physical act of waking up. Going from lying flat to sitting up to standing up, all of that requires rapid cardiovascular adjustment. And if your system is already surging and your baroreceptors are slow, those transitions can push pressure even higher. Now, here's the invisible danger. You don't feel this happening. Robert didn't feel it. Most people don't. You wake up, you feel fine, maybe a little groggy, but that's normal. You have no idea your systolic pressure just hit 180. No headache, no chest pain, no warning. That's what makes the morning surge so insidious. It's completely silent until it's not, until it ruptures something, until a clot forms, until you're in an ambulance. And even then, people rarely connect it to that specific morning window. They just know they had a stroke. They don't realize it happened because their blood pressure spikes dangerously every single morning and nobody was monitoring it. Here's what I want you to do, and I want you to do this starting tomorrow morning. Check your blood pressure within 30 minutes of waking up, before coffee, before breakfast, before you do anything else. Sit quietly for 5 minutes, then take your reading. Write it down. Do this for 7 days. Then compare those morning readings to readings you take in the afternoon or evening. If your morning systolic pressure is 20 points or higher than your evening pressure, you have an exaggerated morning surge. If it's 30 points higher, that surge is significant and needs to be addressed. If it's 40 points or more, you need to talk to your doctor immediately. This isn't something you should wait on. This is a red flag that your cardiovascular system is under severe stress every single morning. Let me tell you what those numbers might look like in real terms. Let's say your blood pressure at 8 p.m. before bed is consistently around 138 over 84. That's reasonable for someone over 65. But then you check it at 6:30 a.m. and it's 178 over 98. That's a 40-point surge. That is dangerous. That kind of spike repeated every single day is doing cumulative damage to your blood vessels, your heart, and your brain. You might not feel it today. You might not have symptoms this week. But over months and years, those repeated surges create microdamage. They weaken vessel walls. They make plaques unstable. And one morning, the surge hits at just the wrong angle, and something gives. That's the stroke nobody saw coming. Except it was coming. Every morning. You just weren't measuring it. So what do you do if you discover you have a significant morning surge? Let's talk about solutions because I don't want to just scare you. I want to give you actionable strategies that can reduce this risk starting immediately. First, hydration. Drink a full glass of water as soon as you wake up. I mean within 5 minutes of getting out of bed. Your body is dehydrated after a night of sleep. Rehydrating quickly helps restore blood volume and reduces the thickness of your blood. This alone can blunt the morning surge by several points. It's simple, it's free, and it works. Keep a glass of water on your nightstand. Make it part of your routine. Second, do not jump out of bed. I see this all the time. Alarm goes off, people throw the covers back and leap up. Terrible idea, especially if you're over 65. When you first wake up, sit on the edge of your bed for 30 seconds. Let your cardiovascular system adjust to being upright. Then stand up slowly. Give your baroreceptors time to register the position change and compensate. This prevents an additional pressure spike on top of the surge that's already happening. Those 30 seconds could prevent a fall. They could prevent a stroke. Take them. Third, timing of blood pressure medication. This is huge and it's something you need to discuss with your doctor. Most people take their blood pressure medication in the morning with breakfast. That's the default. Your doctor says take this once daily and you take it at 8 some a.m. But here's the problem. Most blood pressure medications take 1 to 2 hours to reach peak effectiveness. If you're taking your pill at 8 some a.m., it's kicking in at 10 some a.m. Your morning surge already happened at 6 a.m. You missed the window. Recent research has shown that for many people, taking blood pressure medication at night before bed significantly reduces the morning surge and, more importantly, reduces cardiovascular events. One major study found that people who took their BP medication at bedtime had a 45% lower risk of heart attack and stroke compared to those who took it in the morning. 45%. That's not a small difference. That's enormous. But here's what I need to be very clear about. Do not change the timing of your medication on your own. You need to discuss this with your doctor because it depends on which specific medication you're taking. Some are better suited for nighttime dosing, some are not. Some people are on multiple medications, and the timing becomes more complex. This is a conversation you have with your physician. You say, I've learned about the morning blood pressure surge, and I'd like to discuss whether taking my medication at night instead of in the morning might be appropriate for me. Bring the studies. Bring your morning blood pressure readings. Make it a data-driven conversation. Fourth, sleep quality matters more than you think. Poor sleep, sleep apnea, frequent waking, all of these disrupt your normal nocturnal blood pressure dip. If your pressure isn't dropping at night, your morning surge is starting from a higher baseline. If you snore heavily, if your partner says you stop breathing during sleep, if you wake up gasping, you need a sleep study. Sleep apnea is incredibly common in older adults, and it wreaks havoc on blood pressure regulation. Treating sleep apnea with a CPAP machine can dramatically improve your entire 24-hour blood pressure profile, including the morning surge. Fifth, manage your morning stress. I know this sounds abstract, but it's physiological. If the first thing you do when you wake up is check your phone and read stressful news or emails, your cortisol spikes even higher. Your sympathetic nervous system goes into overdrive. Your blood pressure climbs. Try this instead. When you wake up, take 5 deep, slow breaths before you do anything else. Drink your water, sit quietly for 5 minutes, let your body wake up gently. Don't flood it with stress before you're even out of bed. This isn't about positive thinking. This is about controlling your physiological stress response during the most vulnerable window of your day. Sixth, light exercise after waking can help. I'm not talking about going for a run. I'm talking about gentle movement, some stretching, a slow walk around your house or your yard. Light activity helps your cardiovascular system transition from sleep mode to awake mode more smoothly. It distributes blood flow. It engages your muscles. It can actually help regulate that pressure surge rather than letting it spike unchecked. But again, nothing intense, nothing that raises your heart rate dramatically. Gentle movement. Seventh, caffeine timing. I know many of you reach for coffee first thing in the morning. I get it. I do too. Yeah. But caffeine is a vasoconstrictor. It raises blood pressure. If you drink coffee right when you wake up, right when your pressure is already surging, you're adding fuel to the fire. Consider waiting at least 30 minutes to an hour after waking before you have that first cup. Let the natural surge peak and start to come down, then introduce caffeine. Or switch to decaf for your first cup and have regular coffee later in the morning. Small change, meaningful impact. Now, I need to address a specific group of people who are at even higher risk. If you've already had a heart attack, if you've had a stroke, if you have significant coronary artery disease or carotid artery stenosis, the morning blood pressure surge is not just a risk factor for you. It's a loaded gun. You are in the highest danger category. And you absolutely must be monitoring your morning blood pressure and working with your cardiologist to manage it aggressively. This might mean medication adjustments. It might mean adding a specific medication targeted at the morning surge. It might mean more frequent monitoring, but it cannot be ignored. Your history puts you at dramatically elevated risk, and the morning hours are when that risk peaks. Let me also talk about what your blood pressure pattern should actually look like over 24 hours, because understanding the healthy pattern helps you recognize when yours is abnormal. In a healthy pattern, your blood pressure is moderate during the day while you're active. It dips 10 to 20% at night while you sleep. It rises in the early morning, but not excessively, maybe 10 to 15 points, and then it settles into a daytime baseline. That's the ideal curve, but many older adults show a different pattern. Pressure stays elevated at night, non-dipping. Morning surge is exaggerated, 30, 40, 50 points. Daytime pressure is variable, spiking with stress or activity, and evening pressure sometimes rises again instead of staying stable. This abnormal pattern, this lack of healthy variation, is an independent risk factor for cardiovascular events. It means your system isn't regulating properly, and it needs to be identified and addressed. The best way to see your full 24-hour pattern is with ambulatory blood pressure monitoring. This is a device you wear for 24 hours that automatically checks your blood pressure every 20 or 30 minutes day and night. It gives your doctor a complete picture. It shows the morning surge. It shows whether you're dipping at night. It shows patterns that a single office reading will never reveal. If you're over 65 and you have any cardiovascular risk factors, high cholesterol, diabetes, previous heart issues, family history, you should ask your doctor about getting a 24-hour ambulatory BP monitor test. It's covered by most insurance, it's non-invasive, and the information it provides is invaluable. Here's what I tell my patients when they discover they have a significant morning surge and they're worried. I tell them this is actually good news. You found it. You identified the problem before it caused a catastrophic event. That means we can intervene. We can adjust medication timing, we can modify your routine, we can monitor it closely, and we can prevent what might have otherwise been a completely preventable stroke or heart attack. Knowledge is power, but only if you act on it. Finding out you have a morning surge and doing nothing is worse than not knowing, because now you know the danger and you're ignoring it. So here's your action plan. Starting tomorrow morning, check your blood pressure within 30 minutes of waking up. Do this for 7 consecutive days. Also check your blood pressure in the evening before bed for those same 7 days. Compare the numbers. Calculate the difference. If your morning reading is consistently 20 points or more higher than your evening reading, write down those numbers. Make an appointment with your doctor specifically to discuss your morning blood pressure surge. Don't wait for your annual checkup. This is time sensitive. At that appointment, bring your 7 days of readings. Ask these specific questions. Do my numbers indicate an exaggerated morning surge? Should we consider changing the timing of my blood pressure medication to address this? Would you recommend 24-hour ambulatory blood pressure monitoring to see my full pattern? Am I at higher risk for cardiovascular events because of this surge? And what specific interventions should we implement? These questions put the issue on the table clearly. They're specific, they're backed by your own data, and they require your doctor to engage with the problem directly. Now, I want to hear from you. Have you ever checked your blood pressure first thing in the morning? Have you noticed it's higher than other times of day? Have you ever felt strange in the morning, dizzy or off, and wondered why? Write it in the comments. Tell me what your morning numbers are. I read every comment, and your experience could be the push someone else needs to check their own morning blood pressure and potentially save their life. If this video opened your eyes to something you didn't know was happening in your own body, share it. Send it to anyone over 60. Send it to your parents, your spouse, your friends. The morning blood pressure surge is a silent killer, but only because people don't know to look for it. Once you know, once you measure, once you act, it becomes manageable. Next week, I'm going to talk about another hidden cardiovascular danger that affects seniors. Pulse pressure, the gap between your systolic and diastolic numbers. Most people have no idea what it means, but it's one of the most important predictors of cardiovascular risk in older adults. You're going to want to see that one. Subscribe to Dr. Arya Senior Health so you don't miss it. And one final thing, everything I've shared with you today is based on current cardiovascular research and my 25 years of clinical experience in geriatric medicine. But this is educational information, not personal medical advice. Your specific situation, your medications, your health history, they're all unique to you. Use what you've learned here to have an informed, productive conversation with your own doctor. Be your own advocate. Be informed. Be proactive. Take care of yourself.